Welcome to our channel. In this video, we're diving into the exciting journey of week 1 of pregnancy. Whether you're trying to conceive or suspect you might be pregnant, we're here to guide you through the early symptoms and the first steps in testing. We'll explore what your body might be experiencing, the earliest signs of pregnancy, and how to confirm your pregnancy with tests. Join us as we unravel the mysteries of this incredible first week. Don't forget to like, subscribe, and hit the bell icon for more pregnancy tips and updates. Let's get started. Most people have no pregnancy symptoms at week 1, while others may experience very early pregnancy symptoms such as fatigue, breast tenderness, and mild cramping within the first 5 to 6 days after intercourse. Typically, medical professionals measure pregnancy week 1 from the first day of the last menstrual period. Although a person is not actually pregnant at this point, counting week 1 from the last menstrual period can help determine an estimated pregnancy due date. However, this video will explain pregnancy week 1 as starting a week after conception, meaning the literal first week of pregnancy. A missed menstrual period is often the primary symptom of early pregnancy. Conception, or fertilization, occurs when the ovary releases an egg, ovulation, and a sperm fertilizes it. This can happen about 14 days after the start of a typical 28-day menstrual cycle, but this can vary between people. Implantation begins about 5 to 6 days after conception. This is when the fertilized egg attaches to the lining of the uterus. This movement of the egg may break down blood vessels within the uterus wall, which may cause light bleeding and cramping. Pregnancy symptoms in week 1. Pregnancy symptoms in week 1 trusted source are rare. However, the progression and symptoms of pregnancy are different for every person and every pregnancy. Missed periods. In most cases, the first symptom of pregnancy is a missed or noticeably lighter period. Bleeding. Implantation bleeding is an early sign of pregnancy. It is not like a menstrual period. Instead, it is light bleeding that may involve a single spot of blood or a small amount of pink discharge. The spotting may last for a few hours, or it may last for a few days. Cramping. People may also feel mild cramping as the embryo attaches to the uterus wall. Some may feel these cramps in the abdomen, pelvis, or low back area. The cramping may feel like a pulling, tingling, or pricking sensation. Some experience only a few minor cramps, while others may feel occasional discomfort that comes and goes over a few days. Other symptoms. Other early pregnancy symptoms include nausea with or without vomiting, breast changes including tenderness, swelling, or tingling feeling, or noticeable blue veins, frequent urination, headache, raised basal body temperature, bloating in the belly or gas, tiredness or fatigue, irritability or mood swings, food cravings or aversions, a heightened sense of smell, metallic taste in the mouth. Not all of these symptoms are unique to pregnancy. It is also important to note that early pregnancy does not always cause noticeable symptoms. However, most people notice pregnancy symptoms around 5 to 6 weeks after the first day of their last menstrual period. The best way for a person to find out if they are pregnant is to take a pregnancy test. Negative results. If a person takes the pregnancy test earlier than 1 week after a missed period, it may give a negative result, even if the person is actually pregnant. If a person believes they are pregnant despite a negative test result, they should repeat the test after 1 week. To avoid a false negative result, check the pregnancy test's expiration date and carefully follow the written directions. A person can also have a blood test to determine their pregnancy. This test identifies the presence of HCG in the blood. The blood test can show a positive result a few days earlier than the urine test can, but it may take up to 48 hours to get the results back from the lab. A pregnancy test measures the amount of human chorionic gonadotropin, HCG, hormone in the urine. This hormone is only present when a person is pregnant. As the egg grows into an embryo, The cells surrounding it and later become the placenta produce HCG. It is best to take a pregnancy test as soon after a missed period as possible. A pregnancy test may return a positive result as early as 10 days after conception. However, it typically takes about 3 weeks before there's enough HCG in the urine to produce a positive pregnancy test. At-home test accuracy. There are many affordable and reliable pregnancy tests available over the counter, OTC, or online. A home pregnancy test can tell whether you are pregnant in a few minutes, with most claiming to offer almost 99% accuracy trusted source. Although manufacturers claim these kits are 99%, this claim is based upon the ability of the test to detect an arbitrary amount of intact HCG added to urine samples from non-pregnant people. In many cases, it will not be sufficiently sensitive to diagnose pregnancy in those who have recently missed a menstrual period. To help ensure an accurate result, the best time to take a pregnancy test is 1 week trusted source after a missed period. The results of a pregnancy test are either positive or negative. So that's for this video. If you find it very much informative content, so subscribe, like, and share it with your loved one. Thanks for watching. Until next time, goodbye.